Today, we're going to learn how to properly use and care for your custom Surestep Sprout3D Cranial Remolding Orthosis. We want your family's experience with the helmet to be as simple and easy as possible. By the end of this video, you'll understand what to expect from the cranial remolding journey, how to properly put the helmet on and take it off, what a typical wearing schedule looks like, and how to clean and care for your helmet. Over the coming weeks and months, your baby is going to be wearing their Sprout3D for most of the day. Your orthotist will provide a schedule that will gradually increase the number of hours it's worn. After about a week, this will reach 23 hours per day. It may seem like a lot, but this will minimize the total number of days the helmet needs to be worn and maximize the reshaping. Over time, your baby's head will grow into the cranial helmet, and asymmetries will be gently corrected into a normal range. At first, your baby might be aware of the helmet, but most kids adapt very quickly. Sometimes it's more of a challenge for you as the parent because you want to relieve any anxiety your baby might have. But trust us, your child is going to be just fine. Section 2. Putting the helmet on and taking it off. To put your Sprout3D on, press the button to disengage the latch. Pull the helmet open and place it around your child's head, positioning it just above your child's eyebrows. Close the helmet by lining up the tabs on the seam. Press down on the Surestep triangle icon to secure the latch. If the latch does not easily engage, you should follow up with your clinician to see if adjustments to the device are necessary. Section 3. Wearing schedule. It's important to follow the wearing schedule your orthotist provides. A typical schedule looks something like this. On day 1, your child will wear their Sprout3D for 1 hour, then take it off for 1 hour. You'll repeat this process of 1 hour on and 1 hour off throughout the day, while removing the helmet for naps and bedtime. For day 2, increase the wear time to 2 hours on, then 1 hour off. Again, you'll repeat this process throughout the day, removing the helmet for naps and bedtime. For day 3, increase the wear time to 4 hours on and 1 hour off, and begin leaving it on during nap time. You get the idea, right? Day 4, 6 hours on, 1 hour off. Day 5, 6 to 8 hours on, 1 hour off. Day 6, 8 hours on, 1 hour off, and begin leaving it on at bedtime. By day 7, your child will be wearing the helmet for 23 hours at a time with a 1 hour break. You'll continue this wear schedule until your clinician tells you otherwise. We recommend timing the removal of the helmet for bath time, as it should not be worn in the bath. Plus, this is a great opportunity to clean the helmet. Section 4. Cleaning the helmet. When you remove the helmet for bath time, wash your baby's hair and thoroughly clean the helmet. You might even want to clean it twice a day at first. Use your baby's soap or shampoo. Mix it with warm water and scrub the helmet with a soft brush or washcloth. Allow it to air dry for 15 minutes. Double check that it's completely dry before putting it back on. If you need to disinfect it, you can use 70% rubbing alcohol with a clean cloth. Over the coming weeks and months, you'll have several follow-up appointments with your clinician to evaluate your child's progress. But just because your appointment is several weeks away doesn't mean you need to wait to have your questions answered. Call your clinician anytime. They're happy to help you. If you'd like to learn more about Surestep or Sprout3D, visit us at surestep.net.